So CPR program is going to be growing, and then as I said, we have an opportunity to go and work in the community with TJ Leroy again on April 5th. I was just waiting for confirmation for the lady who was organizing last year. So once she give me the confirmation in the flyer, then I can share it in the group to start recruiting people to go. So that's a Saturday, February,
Oh,
April
that
5th.
was the back to school event, right? Yeah, I was there.
The one that you did the back to school, yes, you were there, yes. But the
Yeah.
one we did for the TJ Leroy, they were doing the huge
Mm,
like a gym like they have
inside.
500 kids and we get t-shirt. Did you get a t-shirt?
Maybe not then. I don't remember
No.
t-shirt.
But I think the one you went to was the school bash, so we were doing the screening, yes.
Yeah, I did a school bash, and then
We
we
did
did
the
like a
eyes and
church or
vision and
something.
stuff, yeah.
Yeah,
And then you were there for the church when we went to the church,
yeah,
yes.
the church one. Yeah.
Yes. So that when Dr. Sharon was doing the hypertensive. Yeah.
hmm
Yes, you were there.
Okay.
Yeah. So the Leroy one, yeah, we didn't go there. Yeah, you didn't go. So it's there. Yeah, I did ask you also, Dr. Sharon, to see if we can go back to the community. And then there's another community that we went in February. Um, Another member invited us to a church and they wanted to see.
hmm
So then we were trying to
Okay.
get ourselves CPR instructors and stuff like that. Are you an instructor for CPR or no?
No, I have my ACLS, but I'm not instructor.
Yeah, eventually, we're going to make you go and do it. No, because the more we go to this
They
community,
want official.
they
Yeah.
want, yeah, they want a certificate. So if we can do for the community, if we just a CPR community, then that's fine. Those ones, it's just we are donating our time to give them the skills at home to help their family. But there's some people
hmm
who wants to actually have the certificate. So if that's the
Okay.
case, I mean, we are working. I just had my BLS, ACLS, and PALS. Now I need to renew my NRP. My
Never
NLP
stop.
instructor. So because I used to be an instructor until when I came to South, and then I let it lapse because I was like, I'm not working in the hospital anymore. So I didn't, but now I do need it back because when you go to Tanzania, it helps if I said I'm an instructor, then we can ask the for free books or because you'll be under like the American Academy of Pediatrics.
hmm
Yeah, so the same thing with the ACLS, the BLS. If we are going to teach it in Tanzania, it helps if we're saying, okay, we are the instructor because they know you're going to be registered with them. So then at least we can say we're going to use your content over there,
hmm
even if they're not paying, but at least they're getting the content. So they'll be happy that, like you go kind of like they're getting a free publicity or something.
Okay.
Um, so having an instructor, because right now, yes, we're just using them as a reference. Like when you take an article and you say you quote them and give them credit, sure, that's it, that's the end of it. But if you're an instructor, so then you actually,
Yeah.
because we said, okay, yes, American Heart, I mean, sorry, American Heart Association says this, and because they give you even the flyers and stuff that we can take and go and actually share with people and
hmm
keep it there because you're an instructor. And we tell them,
Okay.
so then at least we get some discount from them and take stuff there. So it's kind of like almost like kind of official, and you get credit
More
as being an
beneficial.
instructor.
Yeah.
Yes. So and then before we can even go and teach in the hospital and get them the certificate, a little card, because you can say then yes, and then maybe the money that required to pay for those skills, we can raise money and then give them people who are we call kind of like a champion. So we can't afford it to give everybody, but we just the ones that we stay with us and learn the whole content, like and
Yeah.
allow them to do the test. So at least that we have kind of like a super user for them to be able to do that, and then to give us credit that we were able to train the trainers.
Yeah.
Yeah. And
Okay.
sometimes
Yeah, that
they
makes
do
sense.
have funds that if you're going to teach CPR in like third countries or um, poverty
Like
areas,
underprivileged community or
yes, you get credit for those donations and stuff like that. So if we are able, like right now, if you ask, chances of getting is very small. But if you ask as an instructor, because they know you have to go and teach. So then, yes, they might be willing to give us money, because there was one through HCA, they're saying to go and train and teach CPR to what they call vulnerable population. Then yes, they give you, I think there was like 3,000 and something, whatever, um, grant. So you get that, and then you can buy, if you're teaching a few people that they're going to be certified for that. So then we can use that money to pay for it. And then of course you can use the same money to buy the equipment and use it for teaching. So that's the part that we can do that. Yeah.
Okay, that would make sense. Yeah.
Yeah. So I mean, there's a lot of stuff, because once we start CPR, even here in the United States, we need equipment, and the equipment are not cheap.
No.
If you're an instructor, then usually you can get, maybe sometimes people either they stop working doing that, but then they can sell you some of the discounted ones. Yeah. And then we can get that. So that is the plan. Um, yeah. I know for Tanzania, probably they would say, oh, we want you guys to do the training, just the trainer, every single person there in the hospital. Yes, we can train them. They'll be just trained, but not certified, because for certification, you have to also have knowledge assessment. They have to learn the content and then
Mm,
pass the test
the pre-work and the
and then demonstrate the skill. So so far, that's why for CPR we can do some of the theory. We're not going to certify them because we are not the trainers yet. But also, if you do online, they still have to do the exam. So we're gonna do just give them the theory. Even if you're going to do the demonstration with them, it's kind of almost you're doing like a community CPR, that you hope the knowledge will help them over there. But if we are able to get ourselves being instructors, so then we can actually certify them, then it's becoming a
yeah.
stronger program that way. But we're gonna need money, because if we have to be able to pay for their um, certificate, because you have to register them to American Heart Association or American Red Cross, you still have to register them
Yeah.
to get them. So it's gonna require money, and that's why we're going to continue doing the CPR community first, until we are able to raise that money and make it a program that is stable. And I'm sure when we start doing it and they see what we are doing, then getting money
More
or
support.
grants,
Yeah.
it's going to follow, because people are going to be like, oh, okay, you're doing something. Actually, this project is going to do that. So it's something that we can do it and make it practical for everything that we do. It will help people in Tanzania, especially the nurses. Like if we say, okay, we start with all the ICU and emergency room nurses, they have to be trained first. And then if we have the money, then they have to be certified. So that means, yeah, in order for you to do in that area, then
Or at least the charge nurses, or if they have charge nurse, I don't know what the setup, but
yeah, usually they call the clinical officer. Yes. It's kind of a charge nurse. Yes. So clinical officers are always in charge of the unit and over the other nurses, and, get reported, follow up, make the decision. Yes. So if there's emergency, then yeah, we can. You're right. Yeah, if we have less money, then yeah, we can start with those clinical officers to make sure that so clinical officers like kind of the provider side, and then the nursing officer on the nurses side, like those all CNC here they call them. Yeah, so that will help to start to make sure those ones are purposefully trained and certified. Yeah, but we can't certify them if we're not instructors. So, but eventually we will. Eventually we will. So, yeah, I don't know. People are not coming. I know Brie, right now it's hard for 7 o'clock, especially for the if she's at work,
yeah.
because she'll be giving report. So that's gonna be hard. But that's fine. We can schedule another one. We'll probably ask them in the group and see when we need to
I mean, 6 o'clock is probably a
better.
good time because, as long as I remember to set an alarm, because then it's like before I would have to go into work for night shift, and then before you have to do handoff report, even if you're working day shift. But
That's true. Yeah. No, I didn't think of it until I saw you propose. I'm like, okay, that's fine. But then I'm already home. So for me, it was fine. But yeah, you're right, because if somebody is there, at least even listening in, finishing up the stuff, and then they can chime in and answer then without any problem, yes. But 70
Yeah.
people is going to be hard unless you are off. Yeah.
Hmm.
Yeah. So no, that's fine. I don't want to waste too much time of your time. Then we can continue chatting and figure out another date for people who can come. And then we share the just a link, at least that we have one idea of what we are thinking of the CPR. But yeah, so for the CPR, definitely we need to start finding ways of raising money or finding sponsors that they can support us either for the equipment here or in Tanzania, because we need both. I mean, right now for this year, definitely we need it for here. Oh, there's Brie coming. Yeah, we definitely need it for here because we have other spaces. Because right now I'm trying to buy time because we don't have the money yet to buy the equipment. So when people are asking, I try to push them further down. I'm like, okay, maybe we can do
Mhm.
it in May or June. Don't start with March because March is like right now. Um,
Yeah, we're already in.
yeah. So we need money, señorita.
I'm working.
No, that's
I am.
no, I don't mean
I
you
am.
out of your pocket, but yeah, I was telling I was telling Alisa that the TJ Leroy also they have April 5th, and then
Okay.
so we might be doing the CPR. I'm still waiting for them to confirm with the lady who was arranging from last year. But if they say yes, we need equipment.
Oh God.
Remember, we took the
April
equipment
5th.
to Tanzania. Yeah, it's
Yeah.
like just only three
Okay.
weeks. That's it.
Uh, okay. We'll figure it out.
No,
We're gonna have to do fundraising.
no, I mean, yes, we do need to do fundraising. And I did put the link there for CPR fundraising. Yeah. I think I put mine to do what, $20 every month to try and accumulate it. I don't know how much, but yeah, we collect as much as we can. But and I was telling Alisa that in Tanzania right now, the CPR program is gonna need to be bigger than before because they want us to
Well,
do it
it's
everywhere.
yeah, and it's like kind of the base of everything. It's like for PPH, it's for ICU, it's for the ACLS and emergency. So it's the middle, it's the heart of everything.
It
So
is. Mhm.
Mm.
That's what Alisa had a great idea about I was saying, and I said we are working on being instructors. So if we're being instructed, then we're able to, I mean, through the American Heart Association or Red Cross, we can certify people over there. The problem is going to come is how are they going to pay for those cards? So if we have raised money and get the grants and pay, and she said, yeah, because if we don't have enough money, then at least we can start paying for the kind of like a CNC charge nurse or whatever. And I said, over
mhm,
there, they're called clinical officers or nursing officers, same level
right.
as that one. So if we are able to get those people, especially for the ICU and emergency room, those nurses who are actually there, so we can get them to do the whole thing, the theory part and the
Because
knowledge assessment.
here, like if there is a code blue or a rapid response, usually a nurse from the ICU or like from the ER, whoever has more staffing, will go respond to it. So
Yes,
especially the charge nurses are responsible in that case.
yes.
So they should have like, if anybody, if we have to allocate resources, then they should have the higher level of like training.
Yes,
Oh
agree.
yeah.
And then so this is like in my head, like in future, I want to be able to, if we go to the medical mission, we train them and give them whatever the knowledge they need, skills they need, and then we run the code, like a code blue,
Hmm.
see how they respond. Like what we were saying, Elisa, somebody
Mhm.
from wherever the unit, they should be trained already, and then come and attend to this, but
Hmm.
take care of this patient, then go. So it's going to require a lot of coordination, but still, it's like mode of communication. Do we get them the pages? Can they sustain them with the batteries? So, I mean, like there's a lot of stuff that goes into the emergency response. It's a big deal. It's a big deal. Here in the
Hmm.
United States, it's a big deal over there. So CPR by itself is, as I said, Brie, is just the base of it because it can
Yeah.
grow and become bigger and do all the stuff. Yeah.
I mean, here it would be great if, because I told you, I don't know if I told you, Alyssa, I started doing the rapid response. I'm the rapid response nurse for the hospital. So
Okay.
I go to all the rapid responses in the code blues. So here it's great though, because, okay, so let's say there's a rapid response. You have me and I'm the one calling the doctors, giving the orders. Then you have someone, you have RT, which they don't have that there. They don't have
Yeah.
RT. But I would love to like coordinate it. So, okay, they have kind of, I guess, what we did last year, but
Hmm.
more,
Well,
I don't
because
know,
they
more in
don't have
depth.
the resources, then that means that every unit, when they come on, they have to, be assigned roles just in case, like somebody has
Yeah.
to be,
So the same, as I said,
so they
according to
know.
the drill, like at the end of all this training, that's my goal. I want to be able to say, okay, now something happens in the emergency room. How do you notify other people? Who do you call first? When they come, what do they do? Like from
Yeah.
wherever they are, they have to come and respond. They said, yeah, we
Because they
call
don't have
help.
like an overhead system. Like with us, you press the button, the overhead system announces.
Yes.
Yes,
So
they
they
don't
don't
have
have that.
that.
So they said that for them, it'd be like we used to have pages, which works fine.
Mhm.
Like as long as it's
Well,
programmed
so
to
then in that
pages.
case, if there's a recorder, the recorder would also have to be like the caller.
Or for the times, I
Like,
mean, yeah.
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 I
As I
mean,
said, I
that's
mean,
like
like,
steps
that's what I'm
ahead, but
thinking. Like I'm thinking of the CPR, which is the beginning of all the emergencies. Like we call, I mean, we
Hmm.
train them and we call, and then we started seeing how they respond. If what happens if it happens in labor and delivery? What happens if it
yeah,
happens in the med surg floor? So we want to be able to see them respond to the emergency and then run the code from the beginning to end.
yeah.
So
So
are we doing ACLS like we did a little bit last year?
yes,
Because,
Well, because
okay,
they need to know like the medications too,
the,
because
hmm
and the rhythm and all the stuff. Yes,
hmm
that means
which we touched on it
yes.
last year, but
Yes, yeah, they're not going to. That's what we need to do that now. Like we need to give them the information now, and then so they review and review. By the time we get there, at least they remember or they've seen it 2 or 3 times.
mhm,
So that means we have
hmm
to host maybe 3 or 4 sessions. And
hmm
I mean, the good thing is that it's until next year to go to Tanzania. So 3 or 4 sessions does not mean until by December. No, we can have maybe I mean, I don't know, June and May, June and July, whatever, those two. And then the other ones will be January and February. So to give them that
hmm
chance to be able to review. So we can still sending them the video. Okay, guys, review, we either post them questions, maybe 5 questions or something. Let them, at least to keep it in their head. And then when we go there, okay, you guys, we already practice. Okay, where's the crash card? How do we refill this? I know you started with Kilwa. Now we need also the and also Mwananyamala for the crash card. Do they still have that one?
yeah,
Do they have the medication? So all those things we need to ask them now before we get there. So when we get there, then yes, okay, this is what you have. Okay, let's go and start practicing the CPR. Okay, by the end of maybe the first week, we can call one code and see, okay, where the learning opportunities are, and then let's review that second week and then
mhm.
call another one and then see how it is, people are
hmm
responding.
hmm
So it's a big deal.
okay, yeah,
Yeah.
that got huge very quickly.
Oh no, it's gonna explode. It's gonna explode. And I know they said if we do it right, we're gonna get the funds and it's gonna become big and it's gonna end up probably swallow all other programs. That part I know for sure. Because as soon as we start doing in one hospital, they can see the response. They're gonna be like, I mean, Kiro,
Hmm
the police hospital, it's already they want us to go everywhere in the country, and they don't care. They're gonna pay for it.
Nine.
Yes.
Hmm
So, because it's the police and like they order people can go here, go there, wherever.
Yeah.
So I mean that there's an excitement about that part. I mean, yes. Then the other part is just gonna be
I mean, I have like, I love Kiwa and I love teaching there. That's like my favorite.
They're so
Uh,
dedicated. I mean,
yeah.
they inspire me every day, and that's why I just keep pushing it because they really wants to learn. And I was just so excited when I saw them like doing the code. They're like, no, hour 10, because we were like, okay, you ever already seen? No, we want to do it again. I'm like, oh, and everybody
Yeah.
is
I
so
mean,
happy.
it was nice. Yeah. I love Dr. Benella and I love the other hospitals, but I have like a special attachment to QL. I love that hospital. Uh, so nice.
It's kind of like an underdog because they don't have much,
Yeah.
but they really wants to do right.
Yeah.
Mhm.
So it's always nice to help the underdog first.
Yeah, it is. I like it.
Yeah.
So,
No, but that's good. I mean, we keep working on it and try. And on the other side, I'm trying to get the government and all the stuff, people to start paying for our stuff. So at least to reduce the out of pocket for Tanzanian side. So if we get less and less, I mean, if we are able to pay less than now, it'll be good so people don't feel strained. So I'm still working on it. But we need to have a good programs to present and say, this is what we're doing for you. You need to
mhm.
set to help us because you're not going
Mhm.
to get this training from anywhere else. So
So as far as the training, like can we just start with the basic like CPR PowerPoint, like the steps on CPR, kind of like how I teach there, but in a PowerPoint formation, and then we'll get to like ACLS and EKG rhythms and the meds.
So maybe you do like 2 or 3 sessions. So the first one, basic things, identification. Remember, like whatever, just give the CPR stuff and then ask some scenario what the emergency response they have or whatever, something like that. And then the next one, then you come and do kind of like a BLS and ACLS. I mean, ACLS is going to cover BLS, that's fine. So then the ACLS part is there. So now actually the response for those specific things. And then the rhythm and stuff people needs to be able to see. And we give maybe 1 or 2 examples of patients. This type of patient should be in the monitor. You can see this and this and this, and then give them, like kind of like walk them through. Um, we
Mm-hmm.
may even find like a video, maybe 2, 3 minutes video, then they can see what exactly it is. You know, like they actually see people acting it out and then break it down. Like, okay, definitely, did you see that the role of this person is this and this and this and this and this? The role of this person is this. And but they need to know, like what Alisa was saying, they need to know if we're running to there, what are you going to do?
Mhm.
Yeah.
Mm-hmm.
So
Yeah.
if we break it down that way, so the second session and then the third session maybe might be now maybe okay, the patient is now spontaneous respiratory came back. So what are you going to do? The drips now the ICU back is going to go back to the ICU. Or these are the drips. That's how you for the patient this. Then somebody who just recover. What are the things that you need to worry? Hypoglycemia, hypothermia, hypo whatever, bulimia, all those
Mhm.
things.
Mm-hmm.
So to give them scenario, and then we find this examples that okay, this patient had the code, and then this is what we did, and then the nurse's responsibility, the doctor's responsibility. So if we walk them through that way, it is going to make sense. And of course, with the CPR, we need to have a crash cart
Yeah.
demonstrate
Yeah,
each area
absolutely.
and all the drugs. So we can maybe you can even do all the drugs and what to know or what to find out in the crash cart before we do the
Mm-hmm.
ACLS. I think that would be helpful.
Yeah.
Mhm.
Yeah, I'll just do like the very basic crash cart drugs like adenosine, atropine,
Mhm.
epinephrine, stuff like that, because those are
Yeah.
the drugs that are in the crash cart, but very basic.
Um, do they also have include like bicarb in the crash cart, calcium? Because a lot of times we'll just use calcium as a cardioprotective, um, and it helps. So I don't know if that's something that they can include. So like calcium, like it's like 1 gram, like flush, basically.
So we do have two of the
Yeah.
pharmacists in our group from Tanzania, Atu and Josephine. So definitely we
Okay.
can ask them and then they can confirm
Like
with you
amps of
before we do.
bicarb and like
Yeah.
1 grams of calcium. Yeah.
Yes. So
They
then yes,
definitely have bicarb. I saw bicarb.
yeah. So then we can they can go through that part and then we can have also Mrs. Akimbi for this side for the pharmacy if they have the pharmacy question, whatever. And then
Mhm.
so I think if we break it down, it is gonna it's gonna be more beneficial for them. Like you just step by step to say CPR session 1, CPR session 2, so they know it's a series. Then they can come and see that. But that would be helpful, definitely.
Yeah. And then hopefully if
Mhm.
they, I don't know if they have like glucometer with their crash cart, but
No, they don't.
again, that's like Because
No, but
like
I
you
think I
gotta,
mean,
once you do the CPR, then you gotta start thinking, why did they end up like this, you know?
yes. So then that's a huge thing of glucomet, and I need to
Oh,
find out. They
I gotta
have
go. Work's calling me.
okay,
I gotta go really quick.
right.
But
But yeah, so for the glucometer, I need to find out what they use now. So okay, find
because, you know, here it's easy to say because every unit has one. Sometimes they have two,
I
but
know. Okay, what they use. And how often, I mean, if they can find it, can they, I mean, like we have to make sure at least each unit of those acute areas should have one.
yeah. Hmm.
Yeah, so for emergency, then whenever they have the crash cart, it should be, I mean, the glucometer,
Yeah.
it
Because like, you
should
know,
be readily available there, available. So yeah, so those are things that I can ask.
an intubation box, if they have intubation box with their crash cart or not.
So do this because we have those two pharmacists in the group from Tanzania. Ask those questions in there, and then I will tell them to pay attention, start
Yeah.
answering those questions. Yeah, and that will
Because
help.
here, you know, we have calcium, we have bicarb, we have, you know, beef, D50, you know,
Hmm.
because once you start the code, then you have to start, you know, treating.
That's true. Yeah. Yeah, no, that's good. So ask it that in the group, and then I will encourage them to answer them. And then statistic, we know when we're teaching, you can just say, even if you don't have this and you have this one, you can use wherever.
Hmm.
And then, so then we can get them when you guys are presenting, we can get them to chime in and say, okay, in emergency room, I mean, in emergencies, we do A, B, C, D, and we can get probably one of the doctors there, of the emergency room doctors who are doing those CPR and stuff, and then at least to be able to
Hmm.
help. Yeah.
Okay.
Yeah. That sounds good. Yes. And then we can post when is the next meeting because we didn't get the chance. I know Brie, she's still at work, but no, this is good. No, thank you very much. Yeah, I'm gonna let you go now.
All right.
Yeah.
Oh,
Thank you.
okay, thanks.
Okay, bye.
Bye.